be an interactive panel. I want to make this as informal as possible. So if you've got questions during the panel discussion, please go ahead and just raise your hand. And before you ask your question, please tell us where you're from and your position at your organization. Just to get things going, I'd like the panelists to please introduce themselves again and tell us a bit more about what you do at your company.
Good. I'm Chris Gitziak. I'm the Chief Information Officer at IntraHealth. We use technology to alleviate certain bottlenecks in patient healthcare stories and provide a better patient outcome.
Afternoon, everyone. My name is Andrew Brown. I'm the MD of MediSwitch, and MediSwitch is responsible for securely transmitting claims from service providers through to the medical schemes.
My name is Leonard Stubbers. I'm head of IT for a company, Boehringer Ingelheim, and we sell drugs. We're a pusher.
You're an import export.
All right. So, if anyone has any questions about what kind of drugs, you can raise your hands immediately. Just to set the stage, what are the biggest health tech trends today? Just give us a perspective on what's happening out there in the market. Leonard, you can start.
So it's a good question, Abe, because this question comes across my desk a lot. It's like, what's the next thing to hit us, So financial director walks into my office, it's like, okay, what are you going to put in the budget for next year? So the biggest trends from a healthcare perspective is that we're able to get information, and a lot of information out there. And it's all about empowerment. And so everything from an analytic framework right through to educational platforms. We're kind of looking at a very verbose mode of tools and resources that we're trying to converge. So convergence is obviously one of those topics. But we're preparing ultimately for the next stage of IoT, which will be AI, OT, which is artificial intelligence.
Great. Andrew?
Yeah, we're seeing a big trend towards patient centricity, putting the patient in front and center of everything that's being done, and the rise of tools to try and start getting data from patients and asking the patients to actively become involved in their own care. And I think there is a big trend there. Obviously, data analytics, big data, those types of buzzwords. But I do think we're starting to get to a position in South Africa where people are really starting to take this very seriously. And you can see that there are certain organizations that are making huge headway as far as analytics are concerned. I mean, we tend to be a follower in South Africa with regards to a lot of this stuff. I think the other big trend that is coming through is that we know that Amazon Web Services is coming to South Africa. And Microsoft is bringing their equivalent, and those are supposed to be coming soon. And I think that might start to really shape the way that technology is delivered within the context of the country. And it may well change the way that IT managers and heads of CIOs actually start looking at how they deploy technology. And I think that's going to be a big shake-up. The other thing it does, of course, is it means that one of the things that protects us currently is that these cloud-based solutions from overseas can't really work in the South African context because of the fact that we're storing personal data offshore, and there's sort of legalities and issues around that. As soon as Amazon Web Services here and they bring those solutions in, it could really start to mix things up as far as the local technology companies are concerned. So I think it provides choices for the likes of the CIOs, okay? But for the local companies, we need to seriously think about how we're deploying and how we're going to change our business models to counter these sorts of things.
Definitely. From our side, I think we're in a very exciting situation right now in South Africa with people patients becoming more educated themselves. People do tend to look up more information. They do tend to ask for second opinions. I think the very important thing is clear, easy interoperability in software. Guys don't want to install Flash players and update Java and anything like that. They just want to log into a page, easy to use, and take healthcare and at least part of the treatment as an informed decision into their own hands as well. I think that's quite an important thing. The other thing to mention is definitely the rise of AI. That's something we as a company are quite passionate about. We were discussing this earlier this week. A year ago, AI was at a point where it could beat a pretty good chess player. A couple of years ago, Watson beat Big Blue actually from IBM beat chess masters. 2 weeks ago, Elon Musk with OpenAI in the World Esport Championship managed to beat the best Dota team. So that's a 5 versus 5 online game. And they did not teach the AI the rules of the game. It let it figure out by itself. And if it's already at that stage, using it as a triage tool, using it as a diagnostic aid, not a diagnostic tool, a diagnostic aid to doctors in any medical profession, I think that's definitely a hot topic right now.
Yeah. Okay. Let's assume I'm an IT vendor. Leonard, you're from a multinational pharmaceutical. Can you give us some insight into how buying decisions are made at your organization, or generally how buying decisions are made in large healthcare organizations?
So, I mean, obviously the economic model is always going to be there in the background. But when it comes to buying decisions for different solutions, the era has arrived where we want more for less. So budgets are always contracting. I don't think I've ever had a budget that got more. They've always said, okay, I'm not giving you to do more. And it's kind of like the healthcare industry in general. We have a government that's kind of exploited all of its financial resources, and it's now come up with the NHI concept, and it's licking its lips to grab a stab at the private money that's out there. And whilst that's once the buying decision for us is number one is how is the structure serving the best interests not only of the customer but also of the company, because we can look at the commodities, and IT as a service is commoditized. Where the IT guy was the cleverest person in the room, those days have long gone. We have to look at what's best for the objectives that we're trying to achieve. So the economic models must be spanned across things like standardization. And when we talk about standardization, we're looking at things that make it easy for a large group of people. That's the first thing. Economies of scale. If I buy a lot, will I get a reduction in price? Okay. Administration of that particular, what's it going to take? What overheads will it put on my team in order to keep the solution in place? When you as a vendor are coming and sitting in front of me, you need to assume that my financial director just walked out before you came in, and it's just giving me the worst news ever and said, look, we're not giving you more headcount, we're giving you less budget, but we expect more from you. So you need to step into that room and think, I'm going to help you, and this is how I'm going to help you. And, I'm sorry to say that, you've got the printing guys who phone up a storm, and always leaving messages and business cards, and I just think to myself, how would I do this differently? How would I really, open the door and give them a half an hour of my time or an hour of my time to really listen to them? And it's kind of what we're doing in the healthcare industry. IT is basically, for us, is to look at the solution in its context. And that I think is the one thing, in answer to your question, is the one thing that I think it overrides everything. Is what solution? Don't sell me a product. What solution are you selling me? Because if you don't understand my business, you're not really going to get anything out of it.
Yeah, I think we're definitely seeing being on the sell side of this whole this continuum. We're definitely seeing more of a push towards you've got to be selling value. You need to understand the business, but we're also seeing the conversations as simple as this: I'm not going to spend any more money. So either you must give me more value for what I'm currently spending, or you must save me money. There isn't, the economic conditions of the country are dictating that the budgets are all being cut, and they're going to continue to. That's going to continue to happen for the foreseeable future. So we're having to change the way that we're selling, and it's a push to selling value ultimately.
Do you have anything
Yep.
to add to that?
From my side, I believe flexibility of the solution is very important. Like Bennett said, you can't sell a chunk of technology and force it into somebody's workflow and hope it'll make an improvement. You have to identify specific problems and solve them a solution for that problem. So alleviate the issue, alleviate the problems that they're having. And the solution that you deliver to them today might not be a solution that will work in 2 years or in 5 years' time. You need to be flexible, it needs to be interoperable and standards-based to a point where you can keep up with existing technologies and provide more value for that particular auto, definitely.
Okay, thank you. Any questions from the audience? No questions? There's a hand up. No?
Hi, Hugo Vaughan, Crowdframe Consulting. Question me, current structure of the IT costs in health. So typically we've seen in other industries around operational systems, structures of 10% hardware, 10% license, and 80%, you called it overheads, they sometimes call it integration, keeping it alive, adjusting it to fit the business, etc. going forward. So that's operational stuff. The equivalent number for your typical ERPs is around 40 to 50% of these overhead costs. What's the medical landscape look like now as a general question? Obviously specifics are confidential to any particular company.
So it's a good question. So when we look at the ERP costs and you've got the big vendors out there that cost a lot of money. So what you start to see is consolidation happening, and to absorb those type of exorbitant costs, what you start to see amongst most of the multinationals, I would say. I have a personal opinion, but I'll give you what is the general trend amongst the multinationals. The multinationals are consolidating, and they're consolidating outside of this country. My personal view of that is there's a big problem, because we've got a lot of clever people dealing with unique problems on the African landscape, which is extremely valuable to mature markets. So South Africa and Africa in general is seen as an emerging market. So that is the one dynamic and what we have to really keep an eye on. We don't see the price of those ERP systems going down, but what happens is they put the pressure on the multinationals to then consolidate. So you have a single data set, and all the transactions run through the single data set for the economies of scale. So that's on the one side. I hope that answers some of that question. On the other side, we kind of got a government that is not really playing the ball, because it puts a lot of pressure on the fabric that we try. At the end of the day, we're trying to deliver healthcare to millions of people. And for us as a pharmaceutical company, drugs, and innovative drugs at that. And what we're trying to do is to get the support of government to say, how can we get to a bigger footprint? Because if we get to a bigger footprint, you save the money at the end of the day. And that transactional model, needs to be transacted on systems. And so what starts to happen is they look at the multinationals, head offices, just look at the South African. We're such a small amount of the revenue of that particular organization. So what they do is they just say, you know what, we're pulling all the resources out of that country. We'll just change it into an agency model, for instance. So, it's a very good question. Those are some of the dilemmas. Those are some of the answers to some of those dilemmas, as well as my personal view here and there.
I think, Hugo, just in my experience, if you're implementing a large clinical electronic health record system in a pretty large hospital setting, it is as invasive as any ERP solution, in the sense that every part of the broader hospital, be it admin or clinical, is affected by that particular solution, which means that from a software licensing, hardware, training, implementation, and then ongoing operations and maintenance perspective, it isn't unlike a large ERP implementation. In effect, it is a clinical ERP solution. And therefore, from a cost perspective, I think they're pretty much aligned. But because it is complex, I mean, they've got good stuff, but it's complex.
Hi, I'm Peter Bell from Cassiopeia Computational Biology. Just back to security, we're obviously in an age, well, we've always been in an age of war, I suppose. There's massive money being spent on security, both cyber and real-world security. I think a big reason of that is that because everything is obviously centralized, whether it's cloud computing or on your computer or hard copies, it's centralized. And my question is regarding disruptive technologies. What is the possibilities and future of blockchain in healthcare?
Well, if I can answer that, I think security is a big passion of mine. We've been working with a lot of blue chip clients for many years, and security is obviously something that I take very seriously. At the end of the day, this is my personal opinion, is at the end of the day, I don't think a risk from a guy in a garage in China or a hacker in Russia is as big as improper training in an organization. The real risks we see here, data breaches that we've dealt with, are not guys going in, stealing servers or breaking into systems and accessing data. These are people that somebody decides to go to the loo or on tea break, they leave their screen unlocked, somebody walks past and takes a WhatsApp picture of a list of patients because there's a funny name and sends it to a mate of theirs. Right there, that's a breach of security. Another real world case. Somebody whose job it is to shred patient records decides, you know what, I just don't feel like shredding this stuff today. I'm just going to chuck the box away as is. That ends up falling off a truck on the way to the dump site. That's a massive breach of patient security right there. All the medical history in paper and hard copies blown about. That's a real world case. That actually happened. So I think in terms of security, the standards are so good today. Look, yeah, there are people who are very clever. It's a dynamic field, right? But people, it's like Leonard said, there's a lot of clever people doing a lot of things to make sure that these breaches doesn't happen. I believe that education of staff and patients is as critical as hard firewalls at the end of your security line.
So just getting to your blockchain question. Earlier on in the year, I was lucky enough to go to the Health Information Management Symposium in the States. And I attended a day-long session about blockchain in healthcare. And it might have been the jet lag, but by the end of the day, my takeout was I was confused, okay, by exactly how this is going to be applied, because it is a distributed ledger that cannot be contested, okay? Is that necessarily the right way of storing all healthcare data? I mean, how are you going to store a radiology image in that kind of context? I mean, you're not going to. However, anything that is of a transactional nature that can be stored and you want it to be irrefutable, etc., then there are some applications for that. So particularly, coming from switch processing and claims processing, etc., we can see some sort of applicability in that. So I think the conclusion of an entire day of listening to, and there were some real geeks in the room there, was there are going to be some applications for blockchain in healthcare, all right, but it is not this kind, it's not going to disrupt all of the technologies, and it's about the use case. And it really boils down to that. And in healthcare, there are thousands, millions of use cases, and blockchain is not going to solve all of those, and it's not going to disrupt all of those. So it's finding the right answer. And I think what we tend to see happening, people are back, it's like, if you have a hammer, the whole world becomes a nail, and people have got onto this blockchain thing. And I get it from that perspective, that they're trying to find they've got a solution, and now they're trying to find a problem to solve. And it's not going to work like that.
Yeah, so, there's almost like a litmus test. If I can just go back one step, I think enough has been said about blockchain, but, I asked a question a while ago to a group of colleagues and outside of my work environment. And I asked them, can you tell me what the difference between information protection is and data protection? Now, you'll be very surprised when you ask that question, what answers you'll get. And it became very apparent in a very short space of time that there was a clear misunderstanding of where those two camps lie. Because if you can't even get that right, where the one applies to a particular, maybe applies to a device, and the other applies to the content, it doesn't matter what the solution really is, because we're chasing our tails. So what we need to, and it goes back to what you were saying, is you're going to have to educate those people first. Because if they don't even know that there's a problem, it doesn't matter what solution you put in front of them. And what I find myself doing a large part of my time is to get the users to the level of where technology is. And and you have to actually be quite inventive in trying to get that, because if you don't do it, you're dead in the water. So it's like it's a catch-22 situation. So even before you even get to blockchain and those type of things, if your user base and the people that are interacting with the different systems of blockchain services, if they're not even aware of even at a conceptual level, does it really matter? So,
depends on your time scale, I guess.
Very good question, though.
But that said, there is probably a killer application for blockchain in healthcare.
Yeah.
And entrepreneurs out there, that's your job. Go and figure it out.
It's probably there already.
Okay. Just a quick one. There are thousands of health tech solutions out there. You can imagine for a head of IT in a healthcare organization, you probably receive, like you said, calls and proposals, hundreds of them. But then, we just want to get into the head of the IT leader. How should an IT leader evaluate these solutions? We've seen lots of mobile solutions, for instance. How should an IT leader actually approach this process of evaluating a lot of these solutions and picking the right one for the organization?
Yeah, if I can step in there first, I think if you get your head stuck in just evaluating the solutions without really trying to understand what you're trying to solve, you're just going to confuse yourself completely. And it's like walking down the supermarket and looking for cereal. There are so many brands out there. What is it that you're looking for? If you have a pretty clear understanding of what it is that you want to purchase, starting with that, and trying to break that down into its simplest form. What is the problem? Articulate the problem, and then evaluate based on that. Because otherwise, there is so much happening. There's so much information. There's so many people phoning up with, hey, I've got a solution, and won't you evaluate this? And you can get caught up in the hype. And I think that can be an issue. You start to buy into the hype without actually effectively trying to solve the problem that you actually have. So that would be my advice.
I think definitely cost-benefit analysis, but the most important thing is something that solves a particular problem, and not a generic solution that you can't go in with a shotgun approach. You have to solve a very specific problem in an easy way that provides a lot of benefit down the line. That's it.
Yeah, I think just to add to that is, so this is something that's almost like my core job is, and we've learned this the hard way in the industry, in the IT industries. You can be, you know, the head of IT, you could be heading up, you know, network administration or development. If you're running ahead of your company, you failed at your job. It's as simple as that. The trick is to really have traction in this space is you've got to take the business with you. So what that means is, and I have a catchphrase that just says, you know, business drives the process. So what you've got to do is, IT is, we're very clever, we get around, and we do a lot of things, and we have tools that can, you know, change the world in a day. But if you're not taking the business with you and leading behind them, you're not really adding any value to that organization. And I just want to go back to that blockchain question. You know, years ago in the Second World War, what happened was, and this is what we're experiencing now, you know, when the siren used to go off and the airplanes were overhead and the sirens were going off, what would happen is when those sirens sent out a particular message, you would take your family and you'd run to the bomb shelter. Well, we kind of
was Japan yesterday.
yeah, pretty much. So, yeah. And, you know, we sort of had that same thing. You know, companies are really feeling that. You know, whether it's perceived or whether it's real, you know, whether it actually is a ballistic missile flying overhead. But we kind of get that feeling, and what's happening is the business leaders, and not too much in the IT space, the business leaders are getting caught in the hype of security. Whilst it's extremely, extremely important, you know, because it's your intellectual property at the end of the day that could be floating out the front door. You know, you really have to look at what solutions are out there, you know, protecting that family in that niche, you know, and really look at, is the danger perceived or is it real? So,
okay, thanks. We've got about 5 minutes left. Any questions? There's a hand up to my right.
Gentlemen, on a point of dealing with complexity created by emerging trends, my question is, what's your take on e-detailing system compared to old cataloging to sell pharmaceutical drugs? Because already it's getting, there's a lot of confusion about detailing in the market.
Okay, so just to see if I've got your question, you're talking about detailing and detailing around the drugs?
E-detailing system compared to old cataloging. Because
okay.
people are thinking it's going to replace their manpower.
Okay, so
I just want to hear what's your take, because it's a new thing in Africa actually.
okay, so I'll give you it in two corporates. One is from a company perspective. So e-detailing, the question basically just for everybody's consumption. So the reps for a pharmaceutical company used to have this file, the dreaded file, and it used to contain all the clinical data that you would need to impress the doctor to buy this drug. And what's basically happened is that sort of has now moved aside for an electronic equivalent. And they've attached it normally to the back of the CRM system. So there's a demographic question here, because the doctors that you really want to aim at in South Africa fall into a particular age demographic who don't respond to technology per se. So you really have to know your market, okay, in order to get to the bottom of your question. To put it in a general perspective is the e-detailing component, having the doctor sit and have an electronic experience leads towards things where you can bring other technologies into play, like augmentation, where you can take a piece of paper and you can augment that experience and make it more than what it really is. So that's becoming very, very popular. The second adjunct to that is obviously virtual reality. You know, virtual reality is another step off in that direction. So there's a lot of clever things happening out of there. My take on it is, so this is from a company perspective. From my personal perspective is, my take is that reps will become irrelevant in 5 to 10 years. The reason is because of the funding model behind the doctors. You've got the funders who have a particular budget, and if that is getting exhausted, the funder's not prepared to pay anymore. So what happens is the doctor still has, or the healthcare practitioner, has a certain lifestyle that he'd like to still have, and so he sees more in a shorter space of time. And what that really means at the end of the day is that you're not getting the qualitative outcomes that you need. And the doctor, the healthcare practitioner, who used to have the rep come in and sit for half an hour and they'd have tea and have lunch, now it's got 15 minutes, maybe 5 minutes, maybe even 30 seconds. And you've got to now maximize that time. So what we see is the advent of not reps, but professionals coming into that space. The reps, if they cannot step up to that level, will become irrelevant.
Okay, I think we can take one more. Just
mine is just a parting comment. When it comes to managing data security risks, I think the bottom line for me is that, like you say, that a chain can only be as strong as the weakest link. The human element always comes into play, because whatever security safeguards you have in place, it takes only an Edward Snowden to break the system. And an example that we maybe get in the media quite frequently is the American United States presidency. I think that is one would imagine the most secure offices that one would expect, but every now and then you hear of leaks and information and data being leaked to the media. So it's always a question of the human element, how much people are conscientized to follow their conscience and to not give in to whatever incentives lead to these kinds of leaks coming out.
Yeah, that was great. Agreed.
Okay. All right. In closing, there are a number of technology solution providers in the room, I believe, and in your view, what do you think they should? What should they focus on in 2018? What solutions are they not looking at right now that they should focus on in 2018 and going forward? Any idea?
Disconnected environments. So what we see is, obviously from a security perspective, we see a lot of, so if we take physical security as a topic, you know, the reps, as an example, walk around with maybe an iPad and a laptop and all of that. Some of the technologies that are really coming to the fore is disconnected environments, where you can have a Boyd scenario and they can choose which environment they want to interact with. They want to do work, they just need a device that has a processor and some RAM that will connect them to that environment. And once they take it out, you know, they carry on and can go into their personal space. So disconnected environments, that's definitely something that I see taking traction.
I think if all the vendors are going to make a dent in improving health in South Africa, then interoperability and cooperation and actually sharing data. So if your company is doing clinical exams and your company is doing clinical exams, well, that should go into one patient record, or at least be in some health exchange where many people can access it. And I know there are all sorts of security issues and POPIA issues, etc., but those need to be dealt with. And I think if we collectively are focusing on that, I think that will make more of a splash in the South African market than anything else, to be honest.
Yeah, definitely. I think standards-based solutions to eliminate silos in healthcare cannot be stressed enough. It is critical that different departments and different silos become accessible to each other, that information can be shared between specialists without having to jump through 10 different hoops. It's absolutely critical to eliminate those silos. Definitely, very, very relevant. Yeah.
If I can just talk to what you just come back at that again, just quickly. You're absolutely right. Last year, we had some breakaway sessions last year, and I said to Avi, I was not coming back this year for another year, and I've got no solution out of a platform like this. And so I was just telling Avi, I'm back because I networked with somebody last year, and we got a massive project off the ground because of this platform. So there's a pun for you, but what I want to get at is the power of that interchange, and that interoperability. You cannot do it alone. If I just look at the pharmaceutical environment, you can feel it. It's tangible. You're not selling a pill anymore. You will not get anywhere. Your name doesn't open up a door anymore. You need to think more than the pill that you're selling. And you're absolutely right. If you're not thinking of how you're going to connect and how you're going to interoperate between and really drop the ego to a large extent, you don't have to be the cleverest person in the room in order to save a person's life. And you don't have to be that person that has to design the next nuclear bomb, in order to come up with a pragmatic solution that solves a niche in the market from a healthcare perspective. And I just think, if I could just say, just talk. You'd be surprised. Don't always try and think that you're going to sell $1 million solution if I have a chat with this guy. No. You're going to solve a patient's life. If you have that particular approach, and you're solving people's lives, I promise you, the tech will follow. The tech will follow.
Yeah. As a company, we get together now and then, and instead of having IT-centric meetings, we talk about patient stories, real-world cases that happened within the last week, 2 weeks, real solutions that were provided to those patients, where lives were saved, people getting to play with their grandkids another couple of years because of a solution that was designed and implemented. And that's critical. You have to look at it from a patient point of view. And there's standards for a reason. These things aren't law. There's no law that says you have to follow the standard. It's good practice to follow those standards. I think a lot of consumers are not always as queued up on those standards as they should be. At the end of these days, these systems are designed to talk to each other. But a lot of vendors specifically build proprietary technology into their solution to lock guys in. And it's very important to look out for those things and make sure you stay away from it.
Thank you. Thank you. Please give them a round of applause for a great discussion. And just to close the conference up, I'd like to say a few words, just to express our gratitude to all those who made this event a reality. To all our partners, thank you for working with us. Special thanks to our platinum sponsors, MediSwitch and Medimass, who participated last year as well. And thank you for your continued support. And to Intri Health, Eseculic, Meditech, Kyocera, OT Morpho, Menico, and all the other exhibitors and sponsors. We look forward to working with you again in 2018. An event becomes a success only if participants arrive. They are the lifeblood of a conference. Thus, we do express our sincere thanks to all of you who have taken time off work to participate in this event. In the coming days, we will send out photos, video clips, and presentations from this event, so look out for that. You will also receive a questionnaire by email. Please endeavor to complete the questionnaire as honestly and forthrightly as possible, because your feedback is critical to the continued growth and success of this conference. It is my sincere duty to thank all of you here today. Please contribute to this conference in any way you can. Use the concepts that you have learned at this conference to make a real difference in African healthcare. And before I forget, there's a young lady who produced this event. Her name is V. I'm sure some of you have seen her running around. Please give her a round of applause if she's anywhere in the room. And just say thank you to her. And yes, I'm Abi Wakama from IT News Africa. And we are Africa's technology news leader, and we're on itnewsafrica.com. Thank you, and God bless. Thank you.